This is a review of toxicology, drugs, and therapeutic drug monitoring. We're going to study the toxic agents first. You need to know the metabolites of these. Alcohol or ethanol would be what you would drink in your typical alcoholic beverage. Turn into acetaldehyde metabolites. Methanol, which is what we commonly use in hematology for fixing stains and things like that onto a slide, or fixing things onto a slide, turns to formaldehyde in your blood if you were to. Isopropanol, which is your typical rubbing alcohol, like if you get your ears pierced or something like that, that would turn to acetone in your body. Ethylene glycol, and pardon my spelling error there, can turn into calcium oxalate crystals, which can wreak major havoc. In order to treat someone who has drank ethylene glycol, which is found in antifreeze, we would treat that person with ethanol. By giving them an ethanol drip, it would, the oxalate crystals cannot be created in the kidneys, or it can cause them to break down. Carbon monoxide is a toxic element that has 200 times the binding affinity for oxygen. So you, rather than being exposed to the oxygen, your body would rather bind onto the carbon monoxide. Cyanide is toxic because it will bind to your heme iron. Cyanide gas are things that they used in the Auschwitz concentration camp in Germany way back when. Arsenic is also a it's found in rat poison. It's tasteless, but if you become poisoned with it, it can cause hemorrhagic gastroenteritis. Some drugs of abuse. Very important to make note of the fact that urine is the most common screening method. Salicylate would be considered aspirin. Acetaminophen or Tylenol can cause severe hepatic or liver damage. Amphetamines are considered stimulants. Anabolic steroids are like what your bodybuilders would be taking. Cannabinoids or tetrahydrocannabinol is your typical. Cocaine, we detect benzoyl in the test when we do that one. Opiates, we detect 6-acetylmorphine in the test kit. And in the opiate category, we find things like heroin, hydrocodone, all the ONs. PCP is an anesthetic or a hallucinogenic type of drug. Barbiturates are stimulants, and benzodiazepines are depressants, things such as Valium. The gold standard for gas chromatography, mass spectrometry, and screening, though, is usually done with immunoassay. So we're able to tell the physician with doing the immunoassay if they are positive or negative for the drug. But if they want an exact number of how much is in their urine, they would send it for a GC mass spec. All right, therapeutic drug monitoring. These are drugs that are taken that can be toxic if given too much or not effective if given too little. That's why we draw peaks and troughs. Troughs are drawn just before the next dose is given, and the peak is usually drawn a couple of hours after the drug is taken. The different types of cardioactive drugs include digoxin, ketamine, and amiodarone, and you do have to know which category does these fall into. Immunoglycosides are all the antibiotics, so usually in the SIN, vancomycin, gentamicin, neomycin, and chloramphenicol. Phenobarbital, primidone, you need to know that phenytoin means the same as Dilantin, and valproic acid is the same as Depakote. Carbamazepine, ethosuximide, levetiracetam, topiramate, those are your anti-epileptics. Psychoactive drugs include lithium, which are often given to manic depressives, tricyclic antidepressants, and clozapine and olanzapine. Those are given to people with schizophrenia. Then we have our immunosuppressive drugs given to people who may have had a kidney transplant or liver transplant. It's anti-rejection drugs. Cyclosporin, tacrolimus, which is the same as FK506, and sirolimus. An anti-neoplastic is something we give somebody with cancer. An example is methotrexate. An example of a bronchodilator, which we would give asthma, would be theophylline.